Thank you very much and good morning. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Michael Marchbank, who's leading our surgery renewal commitment in British Columbia and doing an extraordinary job. Both Michael and I are honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh people. We're honored to be here on their lands. I wanted to note that the truly, I think, remarkable efforts of people across British Columbia are represented by Michael and many other people who have stepped up in this time of pandemic to lend their passion, their commitment to one another, their expertise to the real challenges of our time. And so I want to acknowledge his effort, acknowledge the effort of everyone involved in the surgical renewal commitment, from the people who ensure that our operating rooms and equipment are clean and safe and usable, to the surgeons and the nurses, to the health sciences professionals, to the people who do rehab, to the people who book surgeries. Everybody involved in the process, and so many more, everyone involved in the process has dug deep and done extraordinary things. As you'll know, 9 months ago, on March 16th, 2020, we postponed non-urgent scheduled surgeries to ensure our hospitals had the capacity for COVID-19 patients. I asked Michael Marchbank, who is the former CEO of Fraser Health, to provide his guidance and leadership to surgical renewal. And on May 7th, we released our commitment to surgical renewal in BC and began calling patients to reschedule their surgeries. We resumed non-urgent scheduled surgeries on May 18th and have been providing weekly progress updates at our Thursday COVID-19 briefings. We provided our first monthly progress report in July, and this monthly report, our sixth, again chronicles the extraordinary work of everyone in this massive undertaking to change how surgeries are delivered in BC. We said that we would begin calling patients on May 7th to reschedule their surgeries, and we did. On November 22nd, 2020, all health authorities completed their calls to 111,584 patients who were on wait lists before May 7th to ask them if they were ready to reschedule their surgeries. We said that we would start scheduled surgeries on May 18th, and we did. Between May 18th and November 12th, 163,696 patients received their surgeries, including 90% of patients who had their surgery postponed in the first wave of COVID-19. We said that we would begin recruitment and training of new staff to ensure surgery renewal had the nursing, surgical, health science professional, and support staff necessary, and we did. Since April 1st, we have hired 33 surgeons, 32 anesthesiologists, 3 general practice anesthetists, 305 perioperative registered nurses, 38 perioperative licensed practical nurses, 171 post-anesthetic recovery registered nurses, and 173 medical device reprocessing technicians. As well, training has started for 172 surgical specialty nurses, with 86 having completed their program. We will continue with our targeted recruitment and training efforts in the months ahead so that we enhance patient care by continuing to increase nursing, surgical, and support staff. We said that from June 15th to October 15th, we would substantially add capacity by extending daily hours of operation, adding Saturday and Sundays to the schedule, operating new ORs where available, and adding contracted capacity. And we did, with 47 initiatives across all health authorities, adding 7,979 hours of operating room time compared to the same time frame last year. We said we would focus on urgent and long-waiting surgeries, and we did, by performing 996 more urgent scheduled surgeries and 6,299 more surgeries for patients waiting longer than 2 times their target wait. We said that we would reduce the summer slowdown period, and we did, achieving a 37% reduction. We said that we would get patients the surgeries they need, and we are doing exactly that. By calling patients and performing more surgeries, we're reducing the time patients wait for surgeries. The total wait list has been reduced by 6% since March 31st, 2020, and by 12% since it peaked at 100,297 patients on May 28th. These are all remarkable achievements at the 6-month mark. Some of them are truly extraordinary, and they make a clear point. Surgical renewal isn't just a hope. It's not just a dream. It's a commitment to patients that's being delivered right here in BC. And with that, I'll again welcome Michael Marchbank, who was here when we presented our first monthly update last summer, and who will speak in further detail about key aspects of our progress and what these milestones mean for continued achievement ahead. Michael.
Thank you, Minister Dix. I appreciate the opportunity to be here today to highlight all that has been accomplished in the short time and talk about our work ahead. I want to reiterate, the first slide please, what you'll see these points in the at a glance, next slide please, at a glance slide, the progress the Minister just reported. Each of these achievements is critically important to changing the way we deliver surgeries in BC and getting the patients the surgeries they need. In the next few minutes, I'm going to focus on several of them because they provide context not only to how we got to this point, but how we'll continue this progress in the future. This is a massive undertaking in our surgical system. I have to say that the progress that's being made today for our patients is, in a word, stunning. It far exceeds all that I saw up to and including my time as a Health Authority CEO. However, it would not be possible without the hard work and dedication of all our frontline staff and all of the leadership within the healthcare system. On our commitment to meet patient needs, and all of us thank them for that. I'll now speak to some of the significance of some of the points that Minister Dix has made. The next slide, please. Health authorities have made an impressive 111,584 calls to patients. But what we've learned from this is that patients have appreciated those calls. It added a kind and reassuring personal dimension during an uncertain period. We also learned that in some cases, patients no longer wanted surgery, or had already had their surgery completed, or were not in fact even on the wait list because of errors. What resulted in this was just over 8,000 patients being removed from our wait lists. This is an important advance for the system because we are now working with a more accurate wait list and we can better devote our attention and resources to these patients. Moreover, we're continuing to call patients waiting for surgery on a quarterly basis so that we can sustain this personal contact and this accuracy. Next slide, please. Minister Dix said our focus on performing more surgeries and adding operating room time is producing welcome results. It's important that we remember that it was mid-June before our surgical capacity returned to the level it was before COVID. Progress continues to be made month over month and week over week. Across the 4 reports being released today, we have performed an additional 1,860 total surgeries, which you can see on this slide. If you include the 904 additional surgeries we did in our second progress report, we have now done 2,764 more surgeries since we ramped up fully in June. This is an excellent accomplishment in such a short time. We can see that the progress continues, as I've said, month over month, but week over week, as the Minister's weekly progress reports since November show the performance is holding steady and even improving. Next slide, please. Under surgical renewal, the immediate focus was shifted to addressing postponed, urgent, and long waiting cases. I know from personal experience and discussions with surgical patients that waiting is perhaps the most difficult thing, and especially if you're waiting for an urgent surgery. And I'm pleased that we've been able to invest in areas to prioritize the patients that need to be prioritized, our long-waiting patients and our urgent patients. To meet these priorities, we have shifted the allocation of operating room hours. Neuro, ENT, ear, nose, and throat, plastic and thoracic surgeries continue to see increases. Orthopedic and dental surgeries also are seeing additional hours. Next slide, please. In making a surgical renewal commitment, we identified several strategies to add the capacity to increase the surgeries being performed. Those included extending surgical days, adding surgeries on weekends, opening new operating rooms, and new operating rooms that weren't being used, reducing slowdown periods, and adding contracted capacity. It was a significant shift, and the response by the health authorities to achieve it has been dramatic. So far, they have implemented 47 initiatives to add capacity and deliver more surgeries to our patients. What we have seen so far includes extending days in 11 operating rooms, adding weekends in 4 operating rooms, opening 23 new or unused operating rooms, maximizing our capacity at our non-contracted sites, and achieving a 37% reduction in summer slowdowns. The health authorities are continuing to add new initiatives throughout the winter and spring to add to the progress that they've made in the first 6 months. What this means is that from April 1st this year to March 31st of 2022, health authorities will add 24% capacity increases over the base year of 2019-20. And what this means for patients and their families is about 99,000 more operating room hours, and this means more surgeries for those who need it. Next slide, please. Next slide. This achievement requires a massive investment in hiring and training nursing, surgical, and support staff. Minister Dix reported our progress so far, and it is remarkable. Each health authority is driving and achieving this progress. Fraser Health has made 70 hires, Interior Health 264, Island Health 146, Northern Health 64, PHSA 31, and Vancouver Coastal has made 180 hires. These hires, and we are continuing to make them all the time, ensure that we have the staff required as we add new capacity. But there's more to it than that. These hires will ensure the sustainability of the surgical renewal commitment going forward, as well as reducing overtime burdens and staff burnout. These are important and critical issues to the system, and on one front we have seen some encouraging news. If we look at the staff in the OR system during the most recent quarter, which ended September the 30th, we have seen a slight reduction in overtime hours. So they are stabilized, and they are and then we are not seeing a significant increase in overtime hours. COVID-19 has challenged all of us to do things differently, to learn and to adapt so that we can continue to care for our patients. This is the foundation on which we have built our surgical renewal commitment. It is a solid foundation, and it is holding. By beginning to make the kind of dramatic progress we have made in these first 6 months, we will be able to continue our success in getting the patients the surgeries that they need. Thank you.
Thank you, Michael, and thank you for all the work. Thank you for all of the healthcare workers, the healthcare professionals, our teams out there who have done this extraordinary work together. And thank you to people at BC, both for their patience and for their commitment and support. I think our COVID-19 response has always counted on the strength that flows from all of us working together, drawing upon the determination within each of us to make the collective difference in keeping all of us safe. Of course, our job is to stop the spread. And as much as we're counting on our healthcare systems for the surgeries we need, everyone involved in delivering surgeries is counting on us to do our job so that they continue to do theirs. We are well into the second wave of COVID-19. Vaccines are being administered across BC. Our hospitalization rates, 367 people in hospital, are among the highest, since our fight began. COVID-19, of course, is everywhere in all health authorities, and we must again force it to loosen its grip. Our BC surgical renewal progress underscores all that's possible when people know that they can count on one another. Everyone involved in delivering surgeries counts on each of us to stop the spread, to keep our hospitals safe and our surgeries possible. Our progress so far in fighting COVID-19 and the remarkable achievements in our surgical renewal commitment make clear, in a pandemic, each of us, every single one of us, has an essential role to play in healthcare. The 6 monthly progress report shows what is possible when we work together. And at this point in our BC pandemic response, working together has never been more essential. When we work together, we stop the spread. When we work together, we save lives. When we work together, our future is brighter. And with that, we're happy to take your questions.
Thank you, Minister. And a reminder to the media to please press *1 to line up for questions. Our format this morning, we will be taking one question and one follow-up. Also, please do not mute your phones. You will not be heard until I call your name. We begin today with Lisa Yuzda, News 1130. Lisa, go ahead, please.
Good morning, Minister. I'm wondering about, and I don't know if you or Ms. Marchbank will answer this, how many people were seriously harmed who missed their surgeries or perhaps passed away before they were done, and how much of this gain is done because people have not pursued elective surgeries during this pandemic, that haven't gone to that treatment in ways that they might have previously?
I think we've provided some of that information every week around the people who've chosen or delayed their surgeries due to COVID-19, and we'll be reporting on that as we have every week. I think the urgency of this response demonstrates the importance we see to people getting the surgeries they need. As you'll remember, during the March and April and May period, we continued to do urgent surgeries in that period. We continued to do emergency surgeries, of course. And so there were, in fact, each week, in the thousands of surgeries performed. So when it was necessary to do surgeries, the system responded and continued to do them. There is an effect. Longer wait times have an effect, and it's why this significant increase, this reduction in the number of people waiting for surgeries, this effort to do, in a pandemic, more surgeries than we were doing before is so important. And so there is always going to be an effect when surgeries that are needed are delayed. We sometimes use the term elective surgeries to suggest, it sometimes suggests to some people that what elective surgeries means is that people have a choice. These are necessary, medically necessary, required surgeries. And so, and elective really means scheduled, that they're scheduled in advance. So what we've done and what we're going to continue to do is ramp up the number of surgeries that we do to deal with any backlog. Essentially, everyone who had their surgeries delayed has had them now dealt with because of this response, and that's why the urgency in our response. And so I think that there is an effect of delaying non-urgent scheduled surgeries, and that's why we've responded the way we have. But you'll remember that thousands and thousands, in the tens of thousands in that period when we had delayed non-urgent scheduled surgeries continued to take place, and those were the urgent ones, those were the emergency ones.
Do you have a follow-up, Lisa?
Yes, regarding the flu, we've had, a minuscule number compared to what we've seen in previous years, I think is what I've seen so far. So I'm wondering if you can just talk about how that has BC avoided the twindemic that was feared of having the flu and COVID at the same time, and what differences that made?
Well, I think it makes a significant difference. Anyone working in an emergency room, in a hospital, in a community clinic, not to mention all those people who might have got the flu and haven't, will tell you what a difference it makes. I would say this about our flu immunization program, and it parallels what's been achieved in the surgical renewal program, that in a time of a COVID-19 pandemic, we've undertaken the largest influenza immunization campaign in BC history. And on the front lines of that have been pharmacists and doctors and public health. So hundreds of thousands of more doses delivered by pharmacists. That's on the immunization side. And it's also clear that the actions we are taking to deal with COVID-19, the fact that I think people have listened to Dr. Henry and are washing their hands more, the fact that we are maintaining physical distancing, the fact that we have COVID-19 protocols everywhere has also assisted. So to say the least, it's good news that we're not dealing with a major year of influenza at the same time as COVID-19. That wasn't by accident. It's again, the people of BC made this happen, our healthcare professionals made it happen, and the extraordinary effort of our team in delivering, as I say, the largest influenza immunization campaign in history also helped make it happen. And it continues. And I just want to say to everybody, you can get a flu shot in BC. And I know that many people, because of the priorities on the COVID-19 vaccination, the fact that we have relatively little vaccine to deal with for COVID-19 doesn't mean that flu shots aren't necessary. In fact, they can be very helpful, and I encourage people to seek them out if they haven't got one already.
Thank you. The next question comes from Binder Sajjan, CTV.
Mr. Dix. Just want to ask you around case numbers and testing. The numbers have remained relatively low and stable through the holidays, but testing levels are also low. Yesterday, BC seemed to have tested just under 6,000 people compared to 51,000 in Ontario, 31,000 in Quebec. Fewer people tested 10,000 people. So why aren't more people getting tested, and how probable do you think it is that the low testing numbers are the reason that our COVID case numbers are lower than the other provinces that are seeing this sort of post-holiday spike?
Well, first of all, Inder, I would say you have to look at all the numbers, and I know that you do. So I know you're asking the question to get the answer, but I know that you do. On hospitalizations and in critical care, we were yesterday at, I think, 367 in hospitalizations and 77 in critical care. And that tells you something as well. And so one of the reasons why there's more concern, I think, in Alberta and Ontario and Quebec is that their situation in acute care is significantly worse than ours. So it's not just the one indicator, cases per day, but other indicators that show that. But look, we're dealing with our own pandemic in BC, and those numbers that I just referred to are significantly higher than they were previously. They were 149, you'll remember, at the peak on April the 5th. In terms of hospitalizations, and 72 in critical care. So obviously 367 and 77 is more than that, and it's a significant challenge. With respect to testing, our goal was to increase capacity for testing. And so we have the capacity to do more than 20,000 tests a day. That doesn't mean we do 20,000 tests a day. I get a lot of this discussion. People ask questions about this. We test what we need to test. We test symptomatic people in BC. And on Tuesday, so yesterday, our testing numbers that are produced have consistently been lower than any other day for us, because what happens on Tuesday at 10 a.m., which is the cutoff to provide that information, is we're essentially reflecting Sundays, which is our lowest day of taking in new tests. But I would expect the testing numbers to increase in the next period. And what it shows is, I think that in a sense, we're testing the right groups of people. Look, this is a serious time for COVID-19 in BC. And I don't think people are looking at other provinces or looking at us. This is a time when we have to dig in and follow public health guidance, and where there are rules, public health, explicit rules and laws, public health rules and laws to stop the spread. We've had the Christmas period. That's now happened, and we haven't really seen what impact that will have one way or another yet. In both case numbers and its potential effect on hospitalizations. So we're obviously actively monitoring that. Dr. Henry tomorrow will be speaking to the public health orders that are in place. But this is a time to really dig in. So we have the testing capacity. If people need to be tested, they should go and get tested. And because it's critical to us finding people and ensuring that, that we stop the spread where someone test positive for COVID-19, that we engage in contact tracing. And the final thing is we've added, of course, huge contact tracing capacity to support this effort. So the testing numbers, we can do more. If people need to be tested and meet the needs and are symptomatic and can be tested, they should get tested.
Do you have a follow-up, Binder?
Yeah, just on, as you mentioned there, the public health orders that Dr. Henry will be speaking to tomorrow. Are you able to set some sort of an expectation for people who are wondering if, they will soon be able to travel within the province or double their bubble given the vaccination program that is underway? And just along with that, would the low testing numbers concern you in any way in terms of perhaps not knowing where this virus may be?
Everything concerns me. About this unprecedented pandemic in our lifetime. So everything concerns us. I mean, the fact that our acute care, our hospitalization numbers are, and our capacity were nowhere near. It's not a serious problem for everybody working in healthcare. We did, in I think the last reported week, another record week over the Christmas break in terms of surgeries in BC, and that's because of the really excellent organization. But there are limits to that if case counts and hospitalization were to increase. So it depends on all of our actions. So I would say that we got to continue to dig in. Remember, let's say because this is the kind of number we're talking about, that we can vaccinate 500,000 people in BC by March 31st. And since we just did 1.5 million for the flu, I think we are doing that. We had, I think, the largest day of vaccination for COVID-19 ever, and that will continue to grow depending on when and how much vaccine we get from the federal level. But let's be clear. On March 31st, that will be 10% of the BC population. So we're going to need health measures for months to come. And we have to dig in now. This is a critical time because in this early period, we're working to make long-term care homes much safer by immunizing all residents and all staff and all essential visitors. We're working in terms of remote Indigenous communities to do the same. We're working on vulnerable populations to do the same. But 10% is just 10%, and that's March 31st, so we've got a long way to go.
Thank you. The next question comes from Richard Zussman, Global TV.
I'm just curious, Minister, about, and I know you've provided these in some updates, about the 10% that's missing here. Like, are those people who said they did not want to do the surgeries? Why are we only at 90%? And is there a concern as we continue through the second wave that we may get to a pressure point that we'll once again need to postpone surgeries?
I don't think we're hopeful that that's not the case. We obviously learned from the spring and what happened in the spring. So that's not what we're looking at, but that is always an option should it be required. But I'm going to ask Michael to speak to the technical question of the 90% and the 10%, which is quite an interesting one.
Yes, thank you. We're actually quite pleased that within the 6-month the time frame that we started, that we are at 90%. How these numbers typically work is that it will slow down as you get closer to the end, but I would expect the end to come within the next 2 to 3 months so that we can get that last 10% of patients who were previously scheduled. For example, sometimes you schedule people and because of a particular reason they can't make the surgery. So there are occasions when that happens, and so it is always hard to get that last 10%, but we're actively working on it, and we will strive to get it within the near future.
Do you have a follow-up, Richard? Richard, follow-up?
Yes, I have a follow-up. Sorry. There's news now that a city councillor in Victoria traveled outside of the country during the break. There's another councillor here on the island who has done the same. First off, what do you think of this? And should there be any discipline for elected officials of any level for not following the provincial health guidance around international and non-essential travel?
I think it's disappointing. And the public has reflected on that. I think, and spoken with one voice on that in our government, and I give credit both to the Premier, the former Leader of the Opposition, Mr. Wilkinson, the current Leader of the Opposition, Shirley Bond, and the Leader of the Green Party, Sonia Furstenau, that MLAs from British Columbia didn't do that. And I think that reflects the collaboration that's occurred across parties and across British Columbia in this regard. So should we? I think the issue isn't about punishing people. The issue is communicating clearly that non-essential travel should be avoided right now. And I would say much of the travel that we've seen described is clearly non-essential travel. And so it's obviously disappointing. And I think people have expressed that disappointment pretty strongly, especially in the jurisdictions which have been affected, other jurisdictions. I don't think it helps to comment further on that. Elected officials, of course, are also held accountable at election time, and that's something the public will have to reflect on, as well as all of their other contributions in those times.
Thank you. The next question comes from Camille Baines, CP.
Mr. Dix, I understand that retired doctors and nurses have been asked again by their respective colleges to apply to get on the temporary emergency registry to work during the pandemic. What other healthcare providers are on that registry and needed specifically to give vaccinations? And does that include paramedics, whose scope of practice does include immunization?
It might. Certainly, to date, it's extended well beyond. So we've had doctors and nurses, and Camille, we actually have the detailed information of how many have re-registered, which I used to, I think, give every week, and is a significant number of doctors, of nursing professionals, of health sciences professionals, of course, of healthcare assistants, of care aides, many of whom have returned to work in this period. And so we are continuing for this period, to ask that group of people to come forward, both directly immunization efforts, but also support other work that the people involved in the immunization or doing the immunization clinics might be doing otherwise. So some of the people who've applied, for example, to be contact tracers are those very people who have re-registered. And so we continue to seek out health resources everywhere to support in this extraordinary effort. It's an absolutely a high priority, to say the least, the highest of all priorities, to ensure people are immunized as quickly as possible, and that's what we're doing. And what you identified is one of the steps we're taking to do that.
Follow-up, Camille?
Yes, I'm wondering if paramedics, if you're asking paramedics in particular who can immunize, they are doing some of that in, I think, in the Anaheim Lake area. And are we expecting mobile units, drive-throughs, late hours for immunization altogether as this ramps up?
Well, remember what we're talking about right now is that, let's give you some examples of where we are. I think yesterday was obviously our highest day of immunization. I think we'll be announcing it at the 3 o'clock briefing, or putting forward certainly more than 5,000 yesterday, all over BC. That includes in First Nations communities and in all our health authorities. So, but right now we're doing targeted immunization, right? Because, and indeed, some of the things we need to do, for example, there were clinics scheduled for today that haven't gone forward because our latest supply of Pfizer hasn't come from the federal government, and 4 of our 5 health authorities have used up all of the Pfizer vaccine that they have. So these are just the early stage challenges that we face, but the clinics are going very well. What will happen when we go broader? For example, when we seek to immunize everyone over 80, we'll be laying that out in detail. But you know, these are both Pfizer and Moderna are new vaccines, and so it requires training and experience, and that's why we're seeking out people with experience in immunization and training to support these efforts right now. But this is what public health does. And you'll note from pharmacists to nurses to doctors, we did, as I say, the largest immunization campaign for the flu in the context of COVID-19, which is pretty impressive, I think. And I'm very proud of the work that all of those people have done. And that kind of thing, as we grow wider, as we get more vaccine in coming months, is something we'll do as well, yes.
The next question comes from Emily Lazaton.
Hi, Minister. With the BC CDC now recognizing airborne or aerosol transmission of COVID-19, does this change or will it change safety protocols and guidelines when it comes to businesses, for example, gyms or certain fitness or yoga classes when they open up again? But more so as well, with the recognition of this, does it change what's going on in schools right now?
Well, I think what we have are in place in all those businesses, that the ones that are operating, because some high-intensity interval training and spinning and other things are not going on right now. But what we have right now are COVID safety plans, which have already changed. They already changed with what was announced by Dr. Henry and by the government in December on the change with respect to mask policy, and the more we know, the more we're likely to change those. And in terms of the public health orders, Dr. Henry will be speaking to the ones that we've announced tomorrow. But I think it's fair to say that it's my expectation that we've got to continue right now to take the actions necessary to stop the spread, and I'm sure Dr. Henry will be speaking to your question tomorrow.
Follow-up, Emily?
Yes, the UK, I think a few days ago or a couple days ago, decided to space out the doses of the vaccine to 12 weeks versus what we're doing, about 4 to 5 weeks. It's been met with criticism, but has that idea been brought to the table by you or Dr. Henry and the team to get an initial dose out to more people from the get-go?
Well, you see, we laid out our plan both on Monday and then previous to Christmas, and our plan aims at a gap of about 35 days between first and second doses. We're continuing to be on a 2-dose regime here in BC. That said, obviously the value of the first dose is obvious. So there's going to be continued science and research on these questions, and we will, as we have in all matters, follow that science and research. But right now, we're looking at a second dose 35 days after the first.
Thank you. The next question comes from Cindy Hernett, Times columnist.
Hi, Minister Dix. When we see vaccinations in care homes, when all staff and residents are vaccinated, how soon afterwards are people going to be able to visit loved ones that they haven't seen for 9 months?
Well, I think it's going to be a while yet. But what the immunization will do in care homes is it will make everybody safer, and it will allow for us to review some of those changes. There are also some changes in essential visitor policy in the province, which we're looking at right now, which I would expect to speak to shortly. So that's on essential visitor policy. But I think in general, it's going to take some weeks before the impact of the immunization is fully felt. And then we can review all of those other questions. It's the lack of visits is something that everyone involved, from my family to every other family, is feeling the effects of. It's profound, and it's now been, it's been 9 months, essentially, which is a long time in anyone's life and a long time in long-term care homes. So the prerequisite to expanding visits will be our immunization campaign, but it takes some time for the vaccines to take effect, some time for everyone to be immunized, although that will be soon, and then we can start looking at what we can do to return some sense or some greater sense of the normal to the lives of people with long-term care and their families who, of course, think about that every single day as I do.
Follow-up, Cindy?
Yes, thank you. Just a clarification. So would that be done home by home, as each home is, everyone receives vaccinations, or are we talking on a health authority basis, or are we going to wait till a province-wide basis until all home staff and residents are vaccinated? And if you want to talk about the next 15 to 22 months for the rest of the postponed surgeries to be done, what kind of momentum is needed to take us to that completion point?
Well, I'm not sure what you mean by that. We've done 90% of the delayed surgeries already, and some of the additional portion are people who, for whatever reason, aren't getting their surgeries, and others have sought to wait. So I don't think the issue of the delayed surgeries is going to take 15 to 22 months. What we're talking about is making up the difference, because you do the delayed surgeries that you would have done in March and April, and there are other surgeries other people referred. But you've seen the evidence today, which is that the number of people on wait lists has been reduced significantly since May. And this is an enormous achievement in the context of a pandemic. Each surgery takes a little longer, so that the increase in the amount of operating times that we put in place deals with that and deals with dealing with the backlog. So I think I have to say we're doing extremely well. With respect to visits in long-term care, just to be clear, it won't be home by home, and that we are not ready to make those changes yet to the overall visit policy, the overall limits on policy. There are some changes that I expect to see in the essential visitor policy sooner than that. but it'll be a province-wide decision. And remember, just because the first immunization has occurred in people now doesn't mean it has immediate effect. It takes some time. And so, but it's one of the things that we will consider in trying to address the visitation policy, which is obviously negatively affecting the lives of people living in long-term care. I talk to people more about that issue than any other issue, and it's one that is of both great personal concern and obviously great concern to everybody in long-term care.
Thank you, and we have time for one more question this morning, and that comes from Isabel Rahum, CBC.
Hi there. I'm just hoping that we can also get a question in the answer in French for this. The first question is just how the increasing number of COVID outbreaks that we're seeing at hospitals impact the surgical renewal plan?
Well, to date, as I say, we'll be announcing this tomorrow, but over the Christmas period we did significantly more surgeries in the healthcare system than over the previous Christmas period. So we're continuing to do very well and address that. Obviously, at a certain point, when there's outbreaks in a particular hospital, it affects surgeries. We saw this after the fire and then the outbreak at Burnaby Hospital, for example, the impact of the outbreak at Lions Gate Hospital. Those are two examples of cases where it affected us, and the one at the University Hospital of Northern British Columbia, which affected us with some relatively small number of cases. So those outbreaks do have an effect. It's one of the reasons why we are high on our priority list is immunizing and making safe our acute care hospitals. It's one of the reasons that we do that, to ensure that we deal with outbreaks. It should also be noted that some people in acute care are essentially waiting for long-term care placement, so effectively they're long-term care patients, and so that group of people is amongst the high priority list to be immunized, as are people in ERs, as are people in ICUs, and so on. But it affects it. It also affects certain kinds of surgeries. One where you essentially have to reserve an ICU bed, for example, would affect that if an outbreak or a large number of COVID cases were to come to a hospital. So that's the reason why everyone has to dig in right now. One of the many reasons to keep people safe, to keep communities safe, to keep long-term care safe, to keep hospitals safe, to keep schools safe. We need to continue to reduce community transmission and take every opportunity to point that out. And that means washing your hands. That means keeping physically distant. That means not going to work sick. That means not having gatherings outside of your household in your home. That means the limits on gatherings that are in place right now outside of the home. All of these things are in place so that we can continue to have a healthcare system that works for all of the other issues, and we can continue to have a society that works for all of the many other things we aspire to do while dealing with the COVID-19 pandemic.
Minister, response in French.
En français, je dirais que, bien entendu, la pandémie a un effet sur les fonctions des hôpitaux. Et donc, quand on a beaucoup de transmission dans une communauté ou quelque chose à un hôpital particulier, tel Burnaby, où il y avait un incendie, et aussi des cas de COVID-19 un peu, dans plusieurs lieux à l'hôpital, cela a un effet sur des chirurgies. Donc, il est bien évident que ce qu'on fait dans la communauté, ce qu'on fait actuellement pour réduire la transmission de COVID-19 aide notre plan du renouvellement chirurgical.
Isabel, do you have a follow-up?
Yes, I do. So there are concerns from healthcare professionals that the vaccine rollout is way too slow. What do you say to those healthcare professionals who are on the front lines here and that are saying that this rollout is far too slow and that vaccines are essentially just sitting on shelves?
Well, that's just not the case. I mean, it's just not the case. Yesterday was the largest day of immunization in BC. It was. In 4 or 5 health authorities, we essentially used up all of our Pfizer vaccine. We're expecting, I think, 16,125 doses. We were hoping for Monday. We're now hoping for either later today or tomorrow from the federal government. So that meant that some that some vaccination clinics in a couple of places had to be delayed today because we didn't have any vaccine. The only limit, really, to the immunization campaign is the amount of vaccine we have. And this is not a criticism of anybody. It's not a criticism of the federal government. It's not a response to the Prime Minister. But we can only deliver the vaccine we have. And just as an example, the Moderna vaccine came in. There were 20,400 doses. Most of it came on New Year's Eve. Well, over the weekend, that vaccine was distributed to 19 First Nations communities and is now being part of immunization campaigns in all of those communities. And so there's nothing waiting on the shelf. But what we are doing, and what we do need to plan to do, is for a time when we have more vaccine. We're expecting in February to be receiving roughly, for example, the Pfizer, I think 40,000 doses a week. And so we'll obviously have to ramp up at that point. But I think you'll see in today's numbers a lot of people being immunized. It is absolutely a priority. We're throwing everything at it. It requires a whole bunch of things once the vaccine arrives to ensure it's kept safe. It obviously involved training, which couldn't start until, with these particular vaccines, until the vaccines were approved by Health Canada. And but it's going ahead, and I think people are doing everywhere in BC from Surrey to Hartley Bay. And today, I think in Terrace, I think everywhere in BC, people are doing a really good job. So what I would say to those doctors is, I think so too. I want to be every day that's a delay in immunization is, someone who's less safe from COVID-19. And especially when we're talking about vulnerable communities, that's important. But, the reality is what I said is that the federal government, which I think is doing a very good job, they've got agreements on 7 vaccines. We're expecting enough vaccine to immunize about 10% of our population by March. I wish it were 40%, but it's 10%. And I'm sure everybody from the Prime Minister to every doctor in the country, to every nurse in the country, to every person watching here wishes it was 40%. But it's 10%. And we're doing a job to focus that 10% on those that are most vulnerable, and that's what we're doing. And that's why you're seeing this enormous evidence, the very significant majority of doses going to workers and residents in long-term care right now, as we reported on Monday. And that's going to continue. But the work's being done. This is what public health does. 1.5 million doses of influenza vaccine in the last 2 months during a pandemic. I think even though there are challenges with these vaccines, we're going to be able to do the 500,000 people and hopefully more easily by March 31st. It may be that more vaccine arrives sooner and that we'll have to obviously ramp up in response to that, and we're hopeful of that. But we're dealing with the vaccine that we have and working closely. And I think everybody at every level, from the federal governments to the provincial governments to everybody who's involved in immunizing people at the local level is going to be 100% all in this effort. So I agree, nothing should be waiting on the shelves, and nothing is.
Thank you, and that's all the time we have this morning. Thank you for joining us.
Thank you.